half of the metacarpals. I like a little bit more, but
It doesn't hurt to have a little bit more, does
no.
it?
Again, this is not enough collimation. This is way too much. It's just I am practicing a Laura.
So this is how you want the thing, or you want it this way?
No, you want it the correct way. Yeah, it's supposed to be right, but no, you want it the correct way. Remember, we only flip it if it's a PA.
Okay.
I just flipped it before because that's driving me crazy that it's supposed to be a right and it's a left. But yeah, you put it normal there.
So on PAs, you flip your marker.
Remember up there, like a chest, things like that. So when you hang it, oh, look at you
mine?
with your little marker. Look, here you got his out. Beep. All right, now we need an oblique wrist. New cassette, 45 degrees. Beep.
When you usually put the patient's hands at 45, don't they move it, or usually, most of the time?
What do you mean?
When you put it at 45, you don't use one of these to put it at 45?
No, the sponges are more trouble than it's worth. It's really just for shaky people is when you want to use it. But you're going to do a wrist x-ray literally in like 30 seconds, the entire thing. You don't want to take all that time to get a sponge. Like, move, don't move.
I just said.
Yeah, there we go. That's normal. Okay, lateral. What do we have to do special?
At 90 degrees.
90 degrees. So now we're going to take them 90 degrees.
Turn sideways.
And we're going to make sure there's a nice 90-degree bend right here. That's what we're looking at, is that bend right there. Straight up.
On that side.
Yep. And now I've got his wrist off to the side, so I'll put it right there. And I'll just bring my leg to the There's a lateral wrist. Beep. Okay. Now we've just done this, and the doctor says, I'm not sure, but I think there's a fracture of the scaphoid. Get me a scaphoid shot. What we would like to do is the PA axial, which is 10 to 15 degrees. And I'm going to have to roll his chair over this way because we want it coming up the long axis of the arm. So we want his arm straight. And now I'm going to ask him, can you ulnar deviate? And there's his scaphoid. So I'm going to put that in the center of the cassette. I have a 10 to 15 degree tube angle. And now I'm just going to put my central ray right on the scaphoid.
Oh, so that's a really small light field.
I mean, think about what size your scaphoid. It's like a thumbnail, right?
Mm-hmm.
It's tiny. And the more collimation you can do, the less scatter. So
Scatter in the picture?
Yeah, we can get higher contrast. Beep. So this one has a tube angle, no patient angle. Now I want to do this, and I said, can you ulnar deviate? And he said, no, it's too painful. So I said, all right.
So this is the hand.
So just relax. This one is the modified Stetcher. This is no tube angle.
With the 20 degree.
Right, so I'm going to give him a little sponge. Just rest your fingers on there, and that just kind of opens up that joint space. And I'm going to put this on the scaphoid. And at the very end, I'm going to say, can you do just a little bit of deviation? Oh, okay. Any is better than none, so you just want to ask just a teeny, teeny bit. Beep. You will be happy campers if you pick that for your...
I was going to say, you can just pick that.
Oh yeah, because that is just its own view. Yeah.
That's what I want.
I'm going to get the freaking, the elbow that has 4.
Yeah. All right. Oh, carpal tunnel. All right, you're not going to be able to see this one. You'll have to come back in another group to see this one. So this one's painful for the patient. So I'm going to go ahead and get everything ready. So 25, 30 degrees. This is to look for that carpal tunnel syndrome. All right, now I'm going to ask him to pull your fingers back and get his plantar, or not plantar, that's palmar surface perpendicular to the IR. And he's going to do a little bit of 10-degree internal rotation.
And you just eyeball that.
Yeah, it's just a small amount of rotation. Okay, now a tangential is skimming. So watch how a skimming works. Look how distorted my central ray is on the hand.
Yes.
You can't even see where it is. Now look at my central ray on the cassette. You see that? Right now I'm penetrating nothing, but I just want to make it disappear into his wrist. It just disappeared. Beep.
Cool.
So if you shoot it like that, you're penetrating nothing. You just want those crosshairs gone. Now you see the shadow down there? See that dip right there? That's the dip we're trying to get right inside of there. So look at the dip and look at my crosshairs. It's right on the dip, right?
Okay.
And beep.
See the dip. You gotta see it.
Relax, patient. Yeah, that was a painful, especially when I have pain wrist. And then you say, hey, I need you to forearm. That was all the wrist. Okay, forearm. Now this one's where the patient starts getting uncomfortable, so you have to let them come and reach. Okay, if you're going to place your arm up here, hand up. All right, and now we need to bring this down on the same plane, so scoot your chair back. There we go. Now we need elbow to wrist on here. Elbow to wrist in the center of the cassette. So over here. All right, and then the last thing you're gonna check is I have elbow, I have wrist. I want a little bit more elbow there. And look at what his hand's doing. It automatically is uncomfortable, so the last thing you have to do is have him roll back out really far. My right marker. Beep. Just checking to make sure that I have elbow crack and wrist crack in the picture.
Okay, so
And the hand is fully supinated.
So the light is just a little bit out.
Past it. Beep. Now we're going to do new cassette. I'm going to have to turn it this way because he needs to be 90 degrees. This needs to be brought down 9 degrees and thumb up. That's a 90-degree bend right there. And then just going to bring this over.
I can't wait to be like proficient.
Yeah. Feels good. And beep. Okay. Now I've got the almighty elbow.
Jen's favorite. It's so hard.
Elbow.
You know, me, 2 bangles.
Oh yeah. Elbow in the center of the cassette. It looks really bad when it's like that. Or like that. Center
so whatever
of the cassette.
you're focusing on is what you want
In the center of the cassette, yep. Down. Super uncomfortable. Hand up. Bring this back over here. Okay. There's an AP, radius and ulnar partially superimposed. Epicondylar plane is parallel to the IR. Beep. New cassette. We're going to start way over on this end because he's going to roll his arm all the way out till your thumb touches the table.
Oh my gosh.
Yeah.
These patients are going to be like...
Oh yeah.
What the hell are you doing?
Okay, so there's an external radius and ulnar are completely separated. Epicondylar plane is 45 degrees to the IR. The radial head, neck, and tuberosity and capitulum are on profile. Beep. New cassette. Okay, we're going to put the elbow back in the center of the cassette. Down. And then I'm just going to have you flip your hand over. Flip.
This is the Lecranon process, right?
No, not yet.
Not
This
yet.
is the...
Sorry.
You're just getting comfy over there. This is the internal rotation will push the trochlea coronoid process. So 45 degrees to the IR, hands pronated. Those two things are on profile, and the radius is crossed over the ulna at the upper 1/3. Beep. Okay, last one, a lateral elbow. Right in the center of the cassette there, 90 degrees, which should look like a little more, so I'm going to straighten that out so that it's perfect 90. Thumb up, very important. No, I screwed that one up with the cassette.
The other way.
Doesn't matter. There is no long axis on this. They're equal axes, so it's not screwing it up doing that. And look at my light field. Even if I turn the cassette this way, still fits. Still fits on there.
Okay.
So the thumb up is to...
Makes everything a lateral. Thumb has to be up, except on 2 pictures, which we're getting ready to do. But everything else, just make it a habit. Thumb up, thumb up, thumb up. Beep. All right. See it on profile right there?
Yep.
Only way you can see that one. Beep.
Bad patient.
All right.
I'm a patient, I don't know.
Now we're not comping on the when you can't fully extend your arm because it's silly. So next is coils. Is all we have? Coils. Okay. I'm gonna grab something. Coil. Okay. So if we're looking at radial head, the arm is 90 degrees and the hand's pronated. So that's his little skinny arm right there. The tube is angled 45 degrees. Let's see if we can make it. Here we go. Sure. All right. So this is to look at radial head. So look over here at the shadow of the radial head. Come around there and look at it. You see how it's all by itself now? And on profile.
Oh, wow.
It's hard to see it because you guys' phone's light.
I don't have mine.
But if you take it off for a second, move it out for a second. Move yours out, Daria. Get out, Steve. Now look. You see that radial head shadow?
Yeah, I see now.
How it's by itself. So if there was a fracture, that threw it out there by itself so that you can see it. Okay, so what it would look like on him, arm, this is the only lateral, only, that the hand is pronated. Only lateral. He's a little more than 90, so pull that there.
And this is the coils.
This is coil for radial head. All right, so just try and picture where his radial head is. Here's his radius, so it's here, but inside there. So I'm just trying to, with a 45-degree tube angle, you're just picturing, I'm going through there and throwing the radial head. It's not on the humerus, so you don't want to be here, right? It's on the forearm. So you're there.
Okay, so this has to be here.
And you've got a 45-degree angle, so if you take your fingers and you go at 45 degrees, and you're exiting right at the radial head, which is pretty much in the crack.
So I can see the light here. So I
You
know
won't
that's
see
going to
light.
get the...
You can see the marker. Look, do you see a little light back there?
No. Oh, now I do. Okay. It's right there. Okay.
All right, then we've got coil for coronoid process, so he's going to come out to 80 degrees, which makes no sense, I know. And then we're going to come your way. And then we're going to go 45 degrees over his shoulder. Get the part in the center of the cassette. All right, so we're doing the same thing, but from the opposite side. It's entering pretty much in the crack on this ulnar side. It's coming in here and exiting out here because coronoid's now over here. Let's see, move your arm, Alex. See if we can see coronoid on here. Ooh, barely. We're here and we come out to 80. Should be visualized, but don't really see it. It's there though. Let's just say it's there. You see it? Little baby beak.
It's only there, no. Too many lights on this side.
Oh, that's why, because they're distorting it with your phone light. Push them off for a second. Oh, there it is.
Yeah.
See that little teeny beak right there?
The inside?
Yeah, that teeny thing. I mean, it's the size of like teeny tiny.
Where is it? Not there.
Right there.
But coronoid process, because it's got that little beak, it
You won't see it with your light.
Yeah, you can't see it with the light. Because you're angling
picking
and
it up.
distorting.
No, it's picking up the shadow.
Okay.
That's why it's so far.
All right, so that's Belbo. Now we got humerus. What's going to change with the humerus?
Wall
We
bucky.
need the bucky now because we're more than 10 centimeters. Humerus definitely is. Angle. Make thickness of my fingers. Does it look like my fingers in the shadow up here? And this one, yes, and that's about even. There's about just as much on top as there is on the bottom. So I think I've got all his humerus on there. So now I'm gonna go ahead and line that up. Okay, and you're just gonna scoot towards me. We wanna penetrate the humerus. Okay, stand back flat, there we go. So now we're penetrating the humerus. Now look, I've got way more on the bottom than I do the top. Okay, now they're both in there. Okay, and then we need, pretend like this is a right marker because yours doesn't have any sticky on it. Right up there. We're going to supinate the hand because we have to do an AP. And can I collimate in?
Yes.
And collimate in some, but look what's happening down there.
You're losing that.
We don't want to lose it. So you'll see people do this when they get a little saucier, is watch this. And now you can go way in.
And it's okay for the.
Just think, your light field is just pivoting on the cassette. The center's, this is still right in the center of the cassette. It's just pivoting on it. But that just allows for more collimation, but I'm not going to do that right now. Let's just leave it normal. There we go. And leave it open, but just show some collimation. That's an AP. My epicondylar plane is parallel to the IR. Greater tubercle is on profile laterally. Lesser is anterior. I'm going to change my cassette. Don't change anything except turn his arm in until this epicondylar plane is now perpendicular. Hold your breath. Beep. Epicondylar plane's perpendicular. Greater tubercle's anterior. Lesser is medial and on profile. Nice. That's that. All right, one more. So he's come in, this arm is in extreme pain. We can't do any turning whatsoever. So first we're just gonna shoot a neutral, which we don't have to learn, but it's just straight on beat. Now how are we gonna get a lateral? We're gonna do that transthoracic. So we're gonna turn towards me. All right, now I'm gonna get this arm up, and I'm gonna look at his humeral heads and make sure they separate, which they are. There's the center of my cassette. So I'm gonna pull him forward right there. That's that.
That's
Look
a
how
little
small the light
bitty
field, but
light
because of
field.
the SOD change, when it gets here, it's still got all this divergence and it's going to hit there. And now he's going to do a teeny bit of anterior rotation, and now I'm going to say breathe normally.
So if you move out of the light, you can see where that marker.
Yeah, so
Okay, so it's still there.
yep. That light's going to be that size. So before you do that one, you've already done this one, the neutral. So you already know your height's correct because you had it here. So then when he turns, the height's the same. This
So you
arm
just
didn't
don't
get
mess
higher or
with that.
lower. Right. So now he turns and you do that transthoracic. And put his arm right in the center there. Good. Arm up, anterior rotation. Breathe normally. Beep. And now you can see this humerus.
Okay.
That be it.